In this video, we're going to talk about some of the common questions people have about the PAE procedure, and specifically talk a lot about prostate cancer. First of all, you should understand that the PAE procedure is designed to treat BPH and should not be thought of as a treatment for prostate cancer. I like to think of the two disease processes as pretty much being two separate lanes. What happens is when you do a PAE procedure, you kill the kind of core of the gland, the part that's pinching off the urethra. It kind of shrinks back and shrivels up. But the outer shell of the gland, the periphery of the gland, still remains alive. We never can completely kill that part of the gland. And that's important to understand because the large majority of prostate cancers, perhaps 3/4 or more, will show up in that peripheral part of the prostate gland. And so whenever we do a PAE procedure, I tell a patient afterwards, no matter how well they do, no matter how great of a result they have, it's important to continue to undergo their age-appropriate prostate cancer screening, which will usually be a yearly PSA, blood level check, as well as a rectal exam. And commonly that's done up until age 80, depending on the health of the patient. It's also important to understand that a lot of people in general will develop prostate cancer at some point in their lives. But there are a lot of prostate cancers out there that are very small or very low grade, very indolent, and can often just be watched. We call this sometimes, it's called active surveillance, where you might get an MRI and repeat biopsies every so often just to kind of keep an eye on things. And so sometimes patients will come to us with low-level prostate cancer, perhaps a Gleason 6 score, that's being watched. And in such a case, we can, if they have BPH symptoms, we can go ahead and do a prostate embolization procedure and really not expect the PAE procedure to have any impact on their prostate cancer, be it the risk for developing or worsening of prostate cancer or improving or getting rid of the prostate cancer. So if we do a PAE procedure on a patient with a low-grade prostate cancer, we tell them just to continue with their active surveillance routine that they have with their urologist. It's really important to understand that we always like to work with the urologist in conjunction with them when we're talking about patients who may have prostate cancer, because it's really kind of a team effort. And again, this procedure is not designed to treat prostate cancer. And we don't like to kind of get in the way of the prostate cancer surveillance or treatment if it's going to happen. Now, another thing to talk about, again, with respect to cancer, is that if there is a prostate cancer that's going to end up needing to be removed, in other words, with a prostatectomy, then doing a PAE procedure doesn't really make much sense because the prostate's just going to get removed and that obstruction issue will get taken care of with that prostatectomy. On the other hand, there are patients who have prostate cancers who need to be treated, but either because of their personal preference or because of their medical conditions, or perhaps the size of the gland, radiation is undertaken instead of a surgery to remove the prostate. So a patient will get external radiation. And so in those cases, whatever urinary symptoms a patient may have can get a lot worse with the radiation, the inflammation that occurs afterwards. And so we can do a PAE procedure before the radiation starts, one, to help minimize the symptoms that a patient has, and two, we can actually shrink the gland down, which can sometimes decrease the radiation that is needed to treat the prostate, which can then lead to lower risks and complications with the radiation field. So that's another important thing to understand, that PAE can be helpful for patients with prostate cancer who are not going to end up getting the radical prostatectomy. No matter what, when we do a PAE procedure, usually the PSA level will drop substantially lower to a lower level than it was before, sometimes less than half, sometimes to a quarter, sometimes to even a tenth. And what's important to understand is that when you're screening for prostate cancer, it's not necessarily about the absolute level of the PSA, it's about the trend, how much is going up and down. And so after we do a PAE procedure, it's important, maybe 3 to 6 months after, for a patient to get a new PSA level drawn. And even if it's much, much lower, they should understand that that doesn't mean they have a lower risk of prostate cancer. It just means that's their new baseline that they'll need to use to kind of interpret subsequent PSA draws and prostate cancer screening efforts afterwards.